This morning I'm going to talk to you about men's health because it's Father's Day. It's the subtitled Healthy Mind, Body, and Soul. And I didn't submit the slides this time, partially because there's games in here. And if you're paying attention, you have the potential to win a prize. And so I'm just going to have you kind of rely on your listening ears, and hopefully I'm saying things that are clear to you. There's an article from the New York Times from back in 2009. That seems like a long time ago now, because that's when my youngest child was born. But it was entitled, "Do Real Men Go to the Doctor?" And basically, it starts off saying real men don't ask for directions, and now researchers say the reluctance to ask for help may not just mean they get lost, it also may take a toll on their health. And so in essence, it's saying that the men who subscribe to that ideal of the strong, silent type who don't complain about pain, who think it's not masculine to ask for help, think they don't get sick and they don't see the doctor, and those stereotypes actually just make them get sick. So I like to try and close the gap and talk about men's health every chance that I get. And I work at the VA, so I see a lot of men. And this is the first job that I've had where I see a lot of men, because in primary care outside of the VA, you do see a lot of women and children. So healthy body first, because that's my area. So the first thing is, but I'm healthy, so why do I need to see a doctor? And I touched a little bit on preventive care last month, but preventive health care is an important aspect of medical practice. It gives you significant improvements to your overall health. It's disease-specific screening. So it's not about the test, it's about the condition that's being screened for. And we screen for conditions that cause the largest burden of suffering. Remember that burden of suffering for a group of patients, okay? So burden of suffering, there's a lot of D's here. Try to remember, I don't know, 3 of them. Death, disease, discomfort, destitution, disability, dissatisfaction. So when I'm saying a burden of suffering, I'm meaning some of those things. The leading causes of death for men overall in the United States, over all the age groups, number 1 is cardiovascular disease, heart disease. Number 2 is cancers in general. And number 3 is unintentional injuries, like accidental death. By age group, it differs slightly. Men between 15 and about 44, the number 1 cause of death is accidents and adverse events. Number 2 for the under 24 is actually homicide and legal intervention. And surprisingly, that hasn't changed since when I first did this 10 years ago. And the update is still homicide and legal intervention. And number 2 for men aged 25 to 44 is suicide. Yeah. So that's a change. And so it's not even really physical health as much as mental health and societal and environmental. Men age 45 to 64, cancers are number 1 and heart disease is number 2. Accidents and adverse events is number 3. And over age 65, we have heart disease, cancers, chronic lung disease. And I had to ask myself, why has that changed? Because number 3 used to be strokes. But I think we're getting into that age group where men were smokers. The 65 and up, back then when it was cool to smoke. And perhaps that, along with exposures for occupations, are making lung disease a little bit higher. And number 4 is strokes. I just added a number 4 because I didn't like number 3 changing. Okay, here's a game break. what is the overall leading cause of death for men in the United States?
Heart disease.
All right, you win.
I would get mine.
Okay. All right, so I'll just ask a bonus one, and then you can have the prize. What is the leading cause of death in men aged 15 to 44 in the United States?
Accidents?
Yeah. All right. So you can have, actually you can choose which one you want. How's that? All right, so when we talk about the screening tests, the most basic thing is when you go in, they check your height and your weight. And the thing that they're looking for is your body mass index. There's a lot of controversy over the body mass index chart because they say, oh, but you know, black people are thicker, so that chart doesn't apply to us. And you know, it's a chart. It's a good jumping off point. There might be some little variations due to race and ethnicity, but overall, if you're obese, you're obese, and we need to do something about it. The next one is blood pressure. Cholesterol test starting at about age 20. Blood sugar, depending on risk factors, if you're overweight, you definitely need your blood sugar checked. And otherwise, I would say 30 would be the highest I would go to weight. Mental health screening in everybody, and screening for sexually transmitted infections for people who are sexually active, and especially if they're sexually active and not in a committed married relationship. And immunization. So those are the screening tests for 18 to say 39. When you get into the 40s, you would add prostate health screening. I think that's the, okay, and then when you get into 50s, you would add colorectal health screening. That's your colon, your intestines, and screening for intestinal colon cancer. Same with age 65 and older. There, you can stop screening for some of these things after age 70, 75, after a discussion, a mutual agreement discussion. And that's when you start weighing where the benefit of treatment would outweigh, you know, the risk of whatever the disease is. The body mass index chart, basically if your body mass index is more than 25, you're considered overweight. If it's more than 30, you're considered obese. The way it's calculated, you know, I suggest you just find a website and plug in your numbers because the formula is your body mass index is your weight in pounds divided by your height in inches squared, the whole thing times 703. Because, you know, that's just easy.
Yeah, okay.
Okay, so, but you could go to like BMI.com or something like that and you plug in your weight and your height and it will calculate your BMI for you. Obesity is a risk factor for diabetes. It's a risk factor for heart disease, a risk factor for gallbladder disease, and some cancers. Things that contributed to it is a sedentary lifestyle and cultural diet choices. So, you know, the grandmas will tell you, don't eat pork. Pork is bad for you. Oh, you stay away from that pork, you'll be fine. I love bacon. I don't think bacon comes from a turkey, and I think it's very important to do things in moderation.
Yes.
I think that there's a danger in eliminating whole food groups and eliminating things that people like, because if they get it, they're going to overdo when they get it again. So my way of counseling is usually telling you to limit and work on portion size and how often you do things, okay? It's too soon for another game, huh? All right. right, that's good. Let's do it anyway. Can someone name 3 burdens of suffering? Go ahead.
Disease, death, and breath.
That one doesn't start with a D. Go ahead, you can.
Wasn't it discomfort?
Yeah, sure, I'll take it.
Discomfort or dissatisfaction?
Is that?
I don't know, let me go back. I think discomfort's a good one.
You think discomfort's a good one?
I think that it's acceptable. It might just be a D, I forgot. It's actually on there. It's right smack in the middle front. Okay, come in and grab a gift. Thanks for listening.
You're welcome.
All right, we'll talk about cardiovascular disease now, but I know I talk about heart disease all the time because it's so important. But when we say cardiovascular disease, we are including stroke, okay? Because it's the blood vessel that we're talking about. So it's not necessarily just your heart. It's the blood vessels, and they have to go to your brain too, and that's how we get strokes. So it includes heart disease and strokes and high blood pressure and high cholesterol. And yes, it includes diabetes, because diabetes is considered a vasculopathy. Vascule meaning your blood vessels, opathy meaning disease of, okay? So diabetes is also a disease of the blood vessels, therefore it is a risk factor for heart disease. Major risk factors, I told you guys about them the last time. There's 5. Family history, high cholesterol, high blood pressure, diabetes, and tobacco use. Those are the 5 major. For stroke specifically, there are some risk factors that you can't modify, that you don't really have control over. Being greater than age 55, your risk for stroke doubles each decade after that, after age 55. And part of that is because your blood vessels stiffen as you get older.
How can we stop that?
Non-modifiable risk factors. Yeah.
Oh, man, that's fine.
Family history of a first-degree relative. That means your mother or father, your sister or brother, or your child. First-degree relative. Ethnicity. African American is greater than Caucasian. And we can't modify our ethnicity, so that's why it's on here. There's thought that some of it is because of the higher incidence of high blood pressure, diabetes, and obesity. So those things can be modified. Okay. Gender, male's greater than female. And if you've had a prior stroke or TIA. TIA is called transient ischemic attack. What that means is that, gosh, what do people call it commonly? A small stroke or a, I don't know what people, they call it something, a mini stroke, a light stroke.
Yeah, we just had a friend, they called it, he had a light stroke.
Yeah.
Like, how do you have a light stroke?
So basically your symptoms resolve within 24 to 48 hours. So you get everything back, but you still had a stroke.
Okay.
It's transient, but you still had a stroke. Modifiable risk factors, we already talked about them: high blood pressure, smoking, diabetes, blood vessel disease, sickle cell disease. It's kind of modifiable, but not really, because they don't have a cure yet. High cholesterol is modifiable. Obesity, poor diet, physical inactivity are all modifiable risk factors for stroke. Another risk factor for stroke is atrial fibrillation. So that's when your heart beats irregularly, and it's irregularly irregular. Okay? So it's just beating any way it wants to. And what happens is that allows little clots of blood to break off. And they go up to your brain and you have strokes. Okay, that's modifiable because you can have medicine to thin out your blood or medicine to control the rate. Okay, but it's a very common, when I graduated from medical school, I did my research project on atrial fibrillation and the blood thinners that people use. You know, they made us do a research project to graduate. So, all right, high blood pressure in men. Definition, this has changed. It changes constantly. But a rule of thumb, the top number is systolic. It should be less than 140. And now, let's just say less than 130. I'm just going for it. Less than 130. If you're diabetic, it needs to be even lower. Yeah. The bottom number needs to be greater than or, less than or equal to 80. Okay? These numbers used to be 140 and 90. They're bringing it down because people are still having disability and death and destitution and all those burdens of suffering. So we have to change our target so that we can reach more people. Hypertension, high blood pressure puts a strain on the heart by increasing its need for oxygen, and it makes it work harder than normal, okay? And when it works harder than normal, then that lower chamber of the heart, the left ventricle, hypertrophies, so that muscle gets bigger, okay? Because it's working so hard. There's no obvious symptoms of high blood pressure. So you don't know you have high blood pressure a lot of times unless somebody checks your blood pressure. It's called the silent killer for a reason. It's silent. There are some people who say they get headaches. I believe them. You know, you can get headache that shows that your blood pressure is high. But I would say by the time you get the headache, it's probably been high. And that's another reason to go and get preventive health care so you can just see where you are in the big scheme of things. High blood pressure develops younger and is more severe in African American men. Yeah. Okay. And I still think that that's probably societal too, because African American men have more stressors on them, and they have the diet issues, and they don't go to the doctor. All right, so some symptoms of high blood pressure that you will see when you already have it. So you can have symptoms like chronic headaches, you can get dizzy, blurry or double vision, seeing little things in front of your eyes, you know, floaters, a general tiredness, a flushed face, nosebleeds, a strong need to urinate often. Actually, is usually diabetes, but can be seen in high blood pressure. A ringing in your ears, your heart beating out of control, nausea, drowsiness. A lot of these things, if you get these, your blood pressure is really high. And you probably need to be in an emergency room somewhere. Treatment, diet, and lifestyle is number one. I would say if you have a new diagnosis of high blood pressure and your blood pressure is not horribly high, giving somebody a chance to change their diet and lifestyle is very empowering. I usually max out at 3 months. You know, I'm not going to give you longer than that because my name is on your chart, and if something happens to you, somebody's going to say, well, doctor, why didn't you treat their high blood pressure? And I was like, I was giving them a chance. Yeah, so that doesn't work. But I'll give you 3 months to do almost anything. So exercise, you restrict your sodium in your diet. You know how they say to shop the perimeter of the supermarket because all the middle aisles have all the sodium and stuff in them. So that means you shop the fruits and vegetables and the meats and whatever's on the other side. There's lots of different kinds of medications for high blood pressure. That being said, most people have to be on 3 different kinds to get it controlled very well. So once you get it, you're not stuck with it. You can modify your lifestyle to get out of it in a lot of cases. But if you're on a medicine and it's not controlling and your doctor is saying you need to add one, don't feel like the Lone Ranger. My mom used to say that all the time. Don't feel like the Lone Ranger. Don't feel like the Lone Ranger, because it's very common to need up to 3. And some people are on a lot more than that. There's some that protect your heart. There's some that protect your kidneys. There's some that are water pills. There's some that regulate your heart rate. And so it's an art to choose the right one for the right person. High cholesterol is a risk factor for heart disease and strokes. There's different components to the cholesterol numbers. You treat on an individual basis. The HDL, that is good cholesterol, high density lipoprotein. It tends to be lower in men. This is one that you want to be high, okay? It's like Pac-Man. This is where my slides would be good, because I got a slide of Pac-Man here. But it's like Pac-Man, and it actually goes around and eats up the bad. So you want to have as many Pac-Man as you can. I do not know why it's lower in men, but it is. The best way to increase this HDL is aerobic exercise. It's better than any of the medicines out there. Aerobic exercise can increase the HDL. The other cholesterol medicines can raise it modestly, but not as well as exercise.
What type of exercise?
Aerobic means it gets your heart rate up. So that means running, walking, biking, doing some jumping jacks, swimming. Can't think of any more right now. Playing sports. Hiking, yeah. The LDL, low density lipoprotein, is the bad cholesterol. Just as a rule of thumb, it should be around 100. You want your number to be 100. 100 is optimal, okay? Normal is 130, but we never tell anybody that, so you didn't hear me say it. You want yours to be 100.
Somebody can be the doctor.
But that's the one that clogs up your arteries, and it's an important risk factor. And then the third component is called triglycerides, and that's just kind of the globs of fat that float around in your blood after I eat the bacon. You know, it floats through, though. It's not adhering to the wall of the blood vessel. But if you get enough of it, it ain't gonna float anywhere, because it's just all gonna band together. So higher risk for heart attack among men who have high triglycerides and a low good cholesterol. So that one should be less than 150. And that one a lot of times is familial. If you have really high triglycerides, your mama probably does too, or daddy, or somebody, brother, somebody. Treatment, lifestyle changes, statin drugs. Niacin actually treats cholesterol pretty well. Nutritional supplements like soy protein, fish oil, garlic are all good for cholesterol. Diabetes, another risk factor, disrupts the way your body uses sugar. Your fasting blood sugar should be less than 100. So there's that number again, the 100. And that's what makes it easy, because if you just have to remember 100, then you are a step ahead. Symptoms of diabetes is needing to urinate frequently, feeling thirsty, blurred vision, just feeling tired all the time. I guess that my take-home message for all of this is, if you go get checked, then you know where you are on the spectrum, and you know whether these are risk factors for you or not. Diabetes treatment is diet and exercise. Diet and exercise. Everything is diet and exercise, and that's the hardest thing in the world for me. They have medicines that you take by mouth. They have insulin that you take as shots. Now there's other medicines that you take as shots as well, not just insulin. And they are really good, and they also help with obesity. So they're kind of like a double whammy. And so, you know, if you can get your insurance company to pay for them, and you can get your doctor to prescribe them, then you got it made. You usually have to monitor yourself at home. And diabetes is followed by a number called hemoglobin A1C. So in short, that's a 3-month picture of how your blood sugar has been. So it's not a fasting test. So if you walk in and you're not fasting, people can still check you for diabetes. And it gives you a number of how it's been. So normal is anything 5.6 or below. Okay, pre-diabetes, you are on the road to diabetes. You jumped on this road, is between 5.6 and 6.4. That's why it's important to be checked, because when you're on that road, you can get off of it with that diet and exercise, okay? Once you hit 6.5, you are diabetic. Even if the next time they checked it and you did all your diet and exercise, and you are 5.2 the next time, you're still diabetic, you're just considered diet controlled. Yes. So you want to catch it when you're not on the road.
Okay.
Oh, I just got rid of a game break. 1, 2, 3, 4. What's a good number for LDL cholesterol or a fasting blood sugar? Somebody raise your hand. Anybody? Okay. Can we hand her this? Okay. Can somebody tell me which of the cholesterols is Pac-Man?
HDL.
You said HDL? You're correct. HDL. High density lipoprotein. All right, we're going to talk about prostate health real quick because that's what everybody want to hear, right, men? So, screening. Screening. You have to be screened, you know? You have to start earlier with African American men because they have a higher incidence of prostate cancer at a lower age, okay? Right now we're saying 45. I think I start checking at 40. It is a blood test, okay? It's a blood test. That means they're going to check your blood for all this other stuff anyway. They can add that on. It's called a prostate-specific antigen, or PSA. If it is elevated and you're not having some symptoms like your urine's not coming out strong or you're not waking up multiple times to go to the bathroom or something like that, you may indeed need that digital rectal exam that nobody wants. What they have found is that doctors don't really do that exam right, and they can't really find that much with it, so that's why it ceased to be the primary screening test. So now it's a backup test because you already know there's something going on, and then you're looking to see if there's something hard or just enlarged. Okay? Colorectal health, that is colon cancer screening. It's the number 2 leading cause of cancer death. So cancers, number 2 is colon cancer. I forget what number 1 is. I'm not gonna guess. Both incidence of colon cancer and mortality of colon cancer are higher in who?
African American men.
Yes. Okay. Prevalence is higher at any given age in men rather than women.
Do we know why?
Nope. There's people studying it. People who care are studying why. I would say diet. It always comes back to diet. Because we eat what they let us eat and what was left over when we were brought over here. And we continue to eat that.
Well, why is it more now than it was years ago? Was it there and nobody just went to the doctor enough to know? Or?
It wasn't screened for before. So you don't know if you're not looking for it. And some of, if we look, some of our relatives may have died from colon cancer and we just didn't know what it was. They just lost a lot of weight and then they were gone. And that's because nobody went and looked for it. So we start screening at age 50. I'm going to recommend age 45 if you can get the insurance company to pay for it because of who? but somebody recently, young
Yes.
actor,
Chadwick Boseman.
exactly. So it was in his family, but I'm saying, I say we should screen earlier. And screening can just be a stool-based test. They give you some little cards, it has instructions, you put some stool on the card, you send it in, and that's it. You don't touch it with your fingers, ever. They give you sticks and gloves and everything else, and y'all touch stuff that's much nastier than your own stool.
What you doing?
Okay. Okay, and then they do have endoscopic examinations called a colonoscopy, where they stick a lighted tube up your rectum and they look around in there. Prior to that procedure, you have to do a complete clean out,
Yes.
which is not pleasant.
No.
And so I would say the lesser of the evils is to do that little stool test. The disadvantage to the stool test is it has to be done every year. Whereas a colonoscopy is every 5 years, 10 years, 3 years, depending on what they find, okay?
They changed it. That's the way that what they give you for the colonoscopy, they changed it.
Uh-huh. Is it more pleasant?
Well, I heard some people say it is because you don't have to drink all of that.
Right, you don't have to drink the volume of stuff, but you still gotta let out as much stuff.
Yeah, but they said the intake is better than it was.
Oh, good.
I heard some people that had to say that.
Yay.
So why do they stick a light up your rectum?
So that they can look inside to see if there's any cancer in there.
They're looking for the telephone number.
All right, and then I think this is my last thing on here is immunizations, okay? So in general, we all need to have a tetanus booster. We should have a seasonal flu shot. Pneumococcal vaccine, that's the pneumonia vaccine. Herpes zoster vaccine, that's the shingles vaccine. Human papillomavirus vaccine, that's more for the young people. Hopefully I have something more on that. And I have added, you guys know which one, COVID vaccine, because I'm getting weary of wearing masks. I'm grateful that all y'all are more than 6 feet away and I can sit here without a mask. But I still have to mask up, wear a shield all day long on my job, seeing people. And I'm tired of it. So I would hope that if more people get vaccinated, that I can at least make, do it for my comfort. All the other reasons.
Okay.
Yeah, just do it so I can do something. Okay. Oh gosh, I didn't say that. Okay, game break. This condition disrupts the way your body uses sugar.
Diabetes.
Yeah, who said it first? Wait, she already got one.
Sure, yeah.
And you already got one.
Yeah, I got one.
Okay, so I got another one.
Another one.
What age should we start screening for colorectal cancer?
45.
Yeah, see, now I was gonna give you a chance and you said the wrong one. She said 45.
Okay.
Yeah. My son says 40. He's my son. That's right. Right. Okay. And then this is the last leading cause of death in black men ages 25. I don't think I remember this one. Yeah, we'll skip that one. All right, so the other reason that men go to the doctor is musculoskeletal strains and pains. That's the main reason we get them in. And so, as the provider, which I hate that term, but as the provider, I have to capitalize on that. So if you are a golfer and your elbow hurts and you can't play golf and your game is going down, you go to the doctor. At that time, I do diabetes screening, high blood pressure, BMI. I send you to the lab. I get you set up for colonoscopy. I do all that, and then I tell you put some heat on it. And take some ibuprofen, and it's gonna get better. Okay. But that's the main reason that they come. But in reality, physical therapy and exercise is usually the first line for all of that. It's not MRI. It's physical therapy, exercise, rested first. Ice, or do you do ice or do you do heat? You do ice if it's swollen, usually for the first 24 to 48 hours, then you switch to heat. Okay? Healthy mind, real quick, mental health screening. I think we talked about this too. We screen for depression, we screen for anxiety. Post-traumatic stress disorder is big in the population that I treat. Alcohol abuse, cognitive impairment, that's dementia, the beginnings of dementia. Healthy soul, because I am married to a pastor, so we are a family that treats mind, body, and soul. So in James chapter 5, verses 13 through 16 in NIV, is any one of you in trouble? He should pray. Is anyone happy? Let him sing songs of praise. Is any one of you sick? He should call the elders of the church to pray over him and anoint him with oil in the name of the Lord. And the prayer offered in faith will make the sick person well. The Lord will raise him up. If he has sinned, he will be forgiven. Therefore, confess your sins to each other and pray for each other so that you may be healed. The prayer of a righteous man is powerful and effective. That's from NIV. Okay? What's the bottom line? Establish a relationship with a primary care doctor. Know your risk factors and numbers. Get screened and get immunized, including COVID. Live a healthy lifestyle, exercise, and eat right. Be a good steward over the temple that God has given you. The last game break. What is the BMI for overweight? No, that's the A1C for diabetes. Body mass index for overweight. That's obesity.
25.
All right, 25. Okay, that's the last game break. And that is it. Thank you very much. If you have any questions, I'm here.
I got a question.
Of course you do.
Well, I'm learning.
I appreciate, I hope that someone is learning.
Oh, yeah. Oh,
Okay.
I've seen people and they've responded and said they love it. So,
Okay.
because we need to, and it's not sugary. So what I wanted to ask you when you were saying about going around the periphery of the store, can you enlighten us the difference between natural sugar and artificial sugar?
So, natural sugar tastes better.
Okay.
It makes you fat.
Oh.
Because it is the thing that, so insulin responds to your sugar intake.
Okay.
Okay? If that is not working properly, then you end up with diabetes. Okay? So sugar has more calories than artificial sugar. That's how you get fat, from the calories. Okay? The thing about artificial sugar that's tricky is it doesn't have more calories, but when you consume artificial sugar, you tend to want more sweets. So it's kind of a catch-22. I still would recommend the artificial over the real if you got to have some sugar, if you're diabetic.
Okay.
But you have to be cognizant of the fact that if you're overeating, even if it's, you know, some artificial sugar, you're still getting more calories and you're not doing yourself any good.
Okay.
Okay? There's artificial sugar out there now called pure cane that's actually made from sugar. You might want to look into that one because the other ones are made from other things. But this is actually made from sugar, but they took all the calories out of it. Yeah. Any other questions?
My last A1C number was 6.5.
or do I need to lower it?
Yes, ma'am. Are you diabetic?
Yes.
Well, then you're marvelously controlled. So I probably would just clap and be happy. If you, because that means, because that means you're so controlled that you're in the pre-diabetes range. So that's good. All right. It's my pleasure to serve you. Oh, sorry. Go ahead.
You have suffered with deep pain from bugs.
Yes, sir.
Use the medication.
Mm-hmm.
Doctor took you off the medication. How safe is it?
How long were you on the medication?
1 year.
So that's the current recommendation. If you get another one, you're going to be on it forever.
The second part of the question is, what is the primary cause? Because the first thing they asked me, have you hurt your leg or have you had a bump or bruise on your leg?
Right, so it's a disruption of the integrity of the vessel, okay? Another cause is sedentary. So that's why they say, like, when you're on a really long plane ride, you should get up and walk around, or a really long car ride, you should stop and take breaks. Because for some reason, when the blood is just sitting there for long periods of time, it tends to clot together. I still believe that that's what my brother passed away from, even though they don't say. I think he had a deep vein thrombosis that went to his lungs because he just died suddenly. And it was after he had driven from Los Angeles to Oakland. And that's a 6-hour drive. And he drove a U-Haul and then passed away. So, you know, I have to believe what the coroner said, but I have my own theory. All right.
All right, if you want to offer prayer, close.
I want you to pray. It's Father's Day.
Like my prayer gonna go.
Yours is going to go everywhere that it needs
May we
to.
stand, please? And we ask if we would take the information to heart as well as to our families and to our communities, because truly the temple of the Lord is a valuable thing, and I am thankful and grateful for Dr. Nancy to be here and to share with us, because it's educational, not entertaining, it's educational, and we can learn about our health. Gracious Father, we thank you for this moment. We thank you for the leadership. We thank you for the instructions and the knowledge that we become better people, not only physically, but spiritually. We thank you that we can